The bleeding doesn't come from the vagina. In as much as maybe you have a tear, it will bleed. So it doesn't matter if we deliver through CS or through normal birth, that placenta has come out, and until that area heals, you will continue bleeding. If she's feeling like she doesn't want to touch this baby, she doesn't want to breastfeed the baby, or if she wants to hurt herself, if she has feelings that she wants to hurt the baby, you're seeing she's not even getting up to shower. When it reaches that point, now people should start looking for help.
Life 360. Hello and welcome back to Life 360. My name is Robbie Omundi. Today I have the privilege of speaking about postpartum recovery. Remember, postpartum recovery entails so much more. It entails mental health. We are talking about how the recovery process is for a mother after giving birth. We're talking about both normal delivery and also cesarean delivery. We are also talking about the nutrition that comes after a mother delivers. I'm privileged to be speaking to Dr. Sauda Farouqi. Karibu sana. Introduce yourself and tell us about basically postpartum recovery.
So I'm Dr. Sauda Farouqi, a gynecologist at Nairobi West Hospital. So we're here to talk about mothers and their recovery post-delivery. We have two types of deliveries that can occur. There's a normal delivery or through C-section, and each has a different timeline that we give the mothers. For normal delivery, definitely the recovery would be a bit faster in terms of the healing of the, if there's any tear or such. And after CS, the wound takes a bit longer to deliver. But the postpartum changes are similar in terms of the uterus, the breasts, because of breastfeeding, and in normal delivery you'll have the vagina needs to heal because the baby has passed through there. The external genitalia, the vulva, they even get some swelling, so that has to heal as well. In CS, especially if it's a planned CS, maybe we are not looking so much at the genitalia healing, but just maybe the uterine healing, the placental bed healing. So it's a whole process. The mother needs to recover from carrying a whole human being within her. And so nutritionally, iron, the small elements, there's a lot of healing that goes on over the next few weeks.
When you're talking about the recovery after a mother has given birth, there's someone who was asking me a question about bleeding. When a woman has given birth normally, definitely there's the bleeding after. Is it the same case when a woman has given birth through the cesarean section?
Yes, of course, because the bleeding doesn't come from the vagina. In as much as maybe you have a tear, it will bleed, but that is imeshonwa, it's sutured, and that should heal on its own. That should not bleed. The bleeding comes from the uterus, from where the placenta was attached. So it doesn't matter if we deliver through CS or through normal birth, that placenta has come out and that area needs to heal. And until that area heals, you will continue bleeding. So there are many factors that will affect, especially during pregnancy, and most of the contributing factor mostly is hormones. We have, as women during pregnancy, they go through a whole host of hormonal ups and downs, okay? And apart from that, there are other now outside factors, like if you have a family history, or if you have, personally you yourself went through something traumatic, you are more vulnerable during pregnancy, okay? And so you're more likely to be affected mentally. Now, after delivery, there's two hormones that are mostly in play, estrogen and progesterone. They drop. And when they drop, a woman experiences, so almost 85% of women will go through something or the other mentally, okay? They might not persist. We call what we call postpartum blues. They might, disappear within a few weeks. But about 10 to 15% will have symptoms that will persist. And they might have postpartum depression, okay? And then another maybe 1 to 2% might even develop postpartum psychosis. So it's all a play of hormones. Then there's also thyroid hormone that is involved, and basically so it's not, you can't say that it's her fault, she's weak, that's why she's going through it. No, a woman is not weak. She's just gone through the process of delivery. She's very strong, but her body cannot handle that sudden drop of hormones. So I can start with the CS first. A CS, there are many factors that play a role. The technique, the environment we're doing the CS, whether if it's an emergency or an elective. You see, elective is a controlled process. You're less likely to get an infection through an elective versus an emergency. Emergency, you've rushed to theatre, you've not even had, in as much as we do the antibiotics, we do the cleaning and draping, but it's an emergency situation. This mother has been in labor, so we don't know the environment behind it. Then secondly, also the mother's immunity herself. Okay, if she's had something that is lowering the immunity, which pregnancy in itself is in a lowered state of immunity, it might predispose her to an infection. Definitely the wound care after delivery, after the surgery, but like I'll give you an example. I personally open the wound up after 2 days. It heals faster when it's open. And then we explain to the mother, this is how you take care of the wound. It's important, of course, to keep it clean. But you've seen all these factors, they play a role. Now, after normal delivery, the healing, how fast and the risks of infection and whatnot, we tell patients to go through, if we have a cut, it's quite messy after a normal delivery, because for women we have the rectum, which is very close to where the vagina is, and so whenever they pass a long call, there is some element of contamination. So again, we do counsel patients that you have to keep washing. You do sitz baths, which is like warm salt water bath. Sometimes you can even immediately postpartum, you can use a cold ice to apply it at the external region to help with the healing. Now you asked about a fistula.
Yes.
A fistula will occur if a mother has stayed in labor for very long. Yes. And so that process, we call it obstructed labor. That can lead to a fistula formation. It's not every patient who's at risk of a fistula formation. Maybe the baby was too big, the mother was too small, she was in labor for too long. So you see, there's a number of factors which, yes, that play a role. This is a 9-month journey, and then suddenly you've delivered. So it's a very anticlimactic process, whereby at once now the baby's out, now what, right? And also the hormones have gone down. So at this point, the mother needs a lot of care, a lot of attention from her partner, from her family, in as much as us as the physicians or the healthcare givers, we can to an extent counsel the patient. The most important thing is how she's going home. So you'll see like a single mother is more at risk for postpartum depression, just for the simple fact about the support. Yes, so these patients, these mothers need more care from their family, either sisters, mothers. It takes a village to raise a child. So they need that family support. They need to be there. Don't put too much pressure on this lady. If she has more children, then maybe we get somebody to help care for the others, because even they need attention. After this new baby is here, then somebody to help her at least with the meals, to help her provide small things. They might feel very small, hot water with salt for sitz baths, or, meals on time, and support while breastfeeding, because now this mother is up all night. In as much as we say, sleep when the baby sleeps. Yeah. It's not as easy.
It's almost impossible.
Yes, yeah. The baby might sleep when it's completely daylight and it's so bright you just cannot sleep at the same time. So, if it helps if they have especially a woman figure with them who can, even if she's expressing milk, can help breastfeed, even if it's not the mother, even the spouse, because we have paternity leave, which is only 10 days, but they can help so that they can take over when she needs to sleep. So we tell mothers, you can express milk, you can freeze it, and then they thaw it when the baby needs to be fed.
Basically, when you're talking about postpartum depression, at what point does it become clinical, and when should now one begin to take action at that point?
It's clinical whenever it's affecting her bond with her baby. If she's feeling like she doesn't want to touch this baby, she doesn't want to breastfeed the baby, or if she wants to hurt herself, if she has feelings that she wants to hurt the baby as well, or if you feel this mother is being very lethargic, you're seeing she's not even getting up to shower, she's very low on energy, when it reaches that point, now people should start looking for help. Okay, I know we have this stigma that, oh, kazana nayo, and just do it, and everybody delivers, and everybody goes through it. We went through it. That's not the way to do it these days. Probably the stresses that we have right now is not the same that our mothers and grandmothers had. It's a very different scenario. So they need to be supportive. They need to, the moment that disconnect between the mother and baby comes, or even herself, she's looking unkempt, she's not eating well, she's not, looking after herself, we need to intervene. So there are supplements that we do provide, but many cultures, different cultures have different ways to deal with it. Like you'll have some cultures will have a dry fruit concoction that they will give the mother after delivery. But basically anything that is healthy, greens, and because now we've lost some blood, so we're assuming maybe your iron level is a bit reduced, in as much as we might be supplementing. Again, many factors come into play, but a healthy diet, greens, and then a lot of fluids, because you're breastfeeding, and breast milk majority is water. So if you don't hydrate yourself enough, you'll find these mothers going into constipation, and then you see they'll feel bloated, they'll not eat well. So fluids, milk, and milk products are important because you're making milk. Sometimes we do put these mothers on calcium supplements or multivitamins, other multivitamins. But if you can get it in diet, fruits, vegetables, the better. So I must say I'm a bit biased when it comes to this, but we have, the antenatal clinic follow-up and all that, we have the supplements we do, and we do it, it's standardized per patient. If you come in and we do, your HB is low, we see you need some special supplements, we will do that, depending on patient to patient. And then that's during pregnancy, that's the antenatal care. The clinics we do routinely, so if somebody needs to come every 4 weeks, that's standard. But if we feel like you need more, specialized care, then we do it 3 weekly, 2 weekly, weekly even, depending on how much attention you need. And then when you come in labor, you see, the rooms are really nice. I think it's out there, it's in the media, and they're all private rooms. You labor in the same room, you deliver in the same room, and you will be discharged from the same room. Sometimes if we want to make space for new patients, you might be shifted to another room, which is a private room, but that's after delivery, after you've been stabilized. So you see, even the risk of infection, because you're not moving from one room to the other, the risk of infection in that itself is reduced, and the mother is comfortable. She has her things where she knows, she knows where her bathroom is, she knows where everything is, so it's a bit easier for her to adjust as well. Number one, pregnancy is not an illness, but when you need to take a break, you need to take a break. You're growing a human being inside you. So if you need to take a break, you need to take a break. You need to go easy on yourself. People around you need to go easy on on you. In as much as we don't tell you to just sit at home, I don't recommend that. You need to be active, especially if you want to deliver normally. I tell my patients, be active, walk, half an hour per day. Start doing squats in your 3rd trimester. All that will help you have, I'm not saying it will reduce the pain, maybe it will shorten the duration of labor, and so you're more likely to, have a normal delivery. And in as much as a lot of people who are coming to me with requests, we want a CS. I would not recommend that. In as much as yes, you have the decision, you are the decision maker, but CS has so many risks associated with it. Even the healing takes longer. So I encourage all mothers to try as much as possible as having a normal delivery. On the other hand, I want to tell patients or mothers, if you've had a CS, you're not any less of a mother. So both processes are, they're very taxing to the body, to the brain, to the mental state of a patient. So I just want everybody to understand and to give this mother the attention she needs, the care she needs. She's special. she's gone through the process. So either way, she's special. So we need to give that extra attention, extra need. And if you need help, please ask for it. As women, we're very, we're strong. We don't need help. No, we have to take a step back and say, here, I need it.
Thank you very much, Dr. Sauda, for your time, and I hope that many women will learn from this conversation and visit Nairobi West Hospital. And to you, my viewer, thank you very much for tuning in up to this end. Be sure to subscribe to our channel and be ready for much more content about health and many other topics that we'll be discussing on this platform. Until next time, my name is Robbie Omondi, and this is Life 360. Bye-bye.